Hello everyone, my name is Dr. Blake and I'm here at Manna Audiology. Thank you for joining us today. So today I'm going to explain what does normal hearing look like versus a hearing loss. So hopefully you guys can see this okay. All right, so this is an audiogram and this is just a graph representation of the test that we do in order to test your hearing sensitivity. So these marks, so this is just an example of someone with normal hearing, but these marks represent the lowest level, so the lowest volume that you can accurately hear those tones. So the red would be the right ear, red is right. Blue would be the left ear, okay? So you can see up at the top of this chart is what we consider the normal hearing range. The further down the chart you go, the worse hearing gets, okay? So you can see that this person has completely normal hearing. All of those marks are in that green box. Now, on the flip side, let's see what it looks like for someone who has a hearing loss. So this is just a generic example. So again, the red is the right ear, blue is the left ear. You can see that normal box at the top. And you can see how the hearing, none of those marks are within that green box. So none of those marks are in the normal range. So this person has a hearing loss all the way across the board. So on this side of the chart, you have your low pitches or your low frequencies. So in this example, the person's low pitch hearing is a little bit better than their high pitch hearing. So the low pitches are in the mild range. The higher pitches are down in the moderate to severe range, okay? So what does this all mean? How can we use this information? So based on the test, this tells us how much volume we need at all of these pitches. Obviously, you're not going to have the same level of volume all the way across the board. So we want to make sure that that hearing aid is fine-tuned exactly to your hearing test. So you can see in this example, this patient is going to need a little bit of volume over here and a lot more volume over here in these high pitches in order to hear in that normal range. So that's essentially how we use this information to program your hearing aids. So once we have this information, what are the next steps? So this is going to tell us whether or not you have a hearing loss, obviously. It's going to tell us whether or not you are a hearing aid candidate. If you are a hearing aid candidate, then we can talk about the different options available to you, the different styles and levels, and have a big old conversation about hearing aids. So hopefully this gave you guys a little bit of insight into what normal hearing looks like versus a hearing loss. If you have any questions or would like to schedule a hearing test of your own, feel free to give us a call. It's 704-845-1717. And also, I apologize, I'm here by myself today. Dana's on vacation, so we miss her, but she'll be back next week. All right, have a great week, you guys.